Hi, I'm Dr. Brett Bingham from Intermountain Pet Hospital, and I'm here to talk about the second most common condition that we diagnose here in our hospital, and that is the itchy dog. The number one is dental disease, but I'm going to talk about the itchy dog because it's such a common problem, and it's what most people have questions about. There are three things that can cause an itchy dog. One is parasites, number two is infection, and number three is allergies. Parasites are pretty easy to identify. We can do a skin scraping. Fleas are pretty easy to find. Treatment's really easy. We apply Revolution, which is ointment you put on the back of the neck. So ask your veterinarian for some Revolution if you have an itchy dog. It's one way to eliminate all those parasites in a very easy and cost-effective way. Number two is infection. Dogs that have yeast or bacterial infections on their skin, and even ringworm, those are all infections. Those can all be itchy. Those can be diagnosed by a cytology, which is where you make a swab and look at it under the microscope. Your veterinarian should be doing a cytology if you have an itchy dog to rule out infection, and there's even a PCR test that can diagnose ringworm. Those are all pretty easy to diagnose and treat. The last thing is allergies, and that's the big question mark. Allergies cause infections, so if you have an itchy dog, you don't just have to treat the allergy, you also have to treat the infection. You can't just treat the infection and forget about the allergy. You have to do both. Allergies are divided into two main categories. There's either a food allergy or an environmental allergy. This is the big misconception in our society. Most people believe, and your feed store employees want you to believe, that most allergies are food related, when in reality that is not true. Only 15% of all allergies in dogs are food allergies. The other 85% are environmental allergies. So typically what we do here in our hospital, if we suspect allergies, is we do a little blood panel. It's an environmental allergy screening panel, and that diagnoses or rules in or out environmental allergies. If that test is positive, then it's very, very likely your dog has an environmental allergy, which is probably not going to be curable. It needs to be managed, and a lot of those dogs we get on a maintenance program so that they stay very happy and comfortable. If the test is negative, then we suspect a food allergy, and then you can do a food trial. The reality is most dogs have environmental allergies, so we get you on a maintenance program to control those allergies. So bottom line, we need to rule out parasites. Revolution usually takes care of that. We need to treat infection, which is quite easy to do, and then we need to identify and manage an allergy, usually starting with a blood panel, and then maybe eventually a food trial. For all you dogs out there that are suffering from allergies, I want to give you hope that they're manageable. They can be frustrating, but they can be manageable with a very, very successful outcome. And I think that's it.